My topic was lung cancer. The first slide is talking about the lungs. Your lungs are a large pair of organs located in your chest. They are part of the respiratory system. As air enters through your body through your mouth or nose, it passes through your windpipe or trachea and through each bronchus and goes into your lungs. And there's just a quick little picture of the lungs. Cancer begins in the cells. Normal cells in the lungs and other parts of the body grow and divide to form new cells as they are needed. When normal cells grow old or get damaged, they die and new cells take their place. When this process goes wrong, new cells form when the body does not need them, and old or damaged cells do not die as they should. Cancer cell growth is different than normal cell growth. Instead of dying, they continue to grow and form new abnormal cells. This buildup of extra cells often forms a mass of tissue called a growth or tumor. Lung cancers start in the cells lining the bronchi and in other parts of the lungs such as the bronchioles or the alveoli. And here's just a quick picture of a normal cell and a cancer cell. And tumors in the lung can be benign, which is not cancer, or malignant, which is cancer. Benign are rarely a threat to life. They do not invade the tissues around them. They do not spread to other parts of the body, and they usually do not need to be removed. Malignant may be a threat to life. They can invade nearby tissues and organs and spread to other parts of the bodies, and often can be removed, but they may grow back. Cancer cells spread. Cancer cells often travel to other parts of the body where they begin to grow and form new tumors that replace normal tissue. This is called metastasis. They can spread by traveling through blood vessels or lymph vessels to reach other parts of the body. When lung cancer spreads from its original place to other parts of the body, the new tumor has the same kind of abnormal cells and the same name as the primary or original tumor. So it's really just saying if the lung cancer spreads to the bone, it wouldn't be bone cancer, it would still be lung cancer. The two major types of lung cancer is small cell and non-small cell. Small cell, about 10 to 15% of all lung cancers are small cell. They tend to grow and spread more quickly and almost always spreads to other parts of the body before it's found. About 85 to 90% of all lung cancers are non-small cell. There are three main subtypes: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Other parts of the body affected by lung cancer. The brain, bones, nerves, vocal cords, and the liver can all be affected by lung cancer. The brain. When the brain is affected by lung cancer, you can have visual problems, memory loss, headaches, loss of strength, and or partial seizures can occur. And that's just a quick picture of the brain. When the bones are affected, you can have discomfort in the vertebrae or the backbone or the ribs and thighs. And you'll just see some bones right there. When the liver is affected, it is most often without any symptoms. But that's not always the case, but most often. The nerves. When the nerves are affected, you can have aching pains in the shoulders or the outer sides of the arms. And it's a good picture of some nerves going throughout your body. The esophagus. When the esophagus is affected, it can be difficult swallowing, but this often occurs after a part of the lung has collapsed. Symptoms of lung cancer. Most lung cancers do not cause any symptoms until they have spread too far to be cured, but in some people, symptoms do occur in the early stages of lung cancer. Most common symptoms are a cough that doesn't go away, weight loss, loss of appetite, shortness of breath, feeling tired or weak, coughing up blood, infections such as pneumonia that doesn't go away or keeps coming back, chest pain that is often worse with deep breathing, coughing, or laughing. If lung cancer spreads, it may cause back pain, like back in the bones, like pain in the back or the hips, nervous system changes such as headaches, dizziness, balance problems, and seizures, yellowing of the skin and eyes, jaundice, lumps near the surface of the body. Some lung cancers can cause a group of very specific symptoms, which are often described as syndromes, such as the Horner syndrome or the superior vena cava syndrome. The Horner syndrome can cause drooping or weakness of one eyelid and reduced or absent sweating on the same side of the face. The superior vena cava syndrome can cause swelling in the face, neck, arms, and upper chest. Also can cause headaches, dizziness, and change in consciousness. Treatment options. Chemotherapy, radiation therapy, and surgery are a couple of treatments. Treatment options for patients with lung cancer are determined by histology stage and general health of the patient. The patient may receive more than one type of treatment, but an experienced lung cancer pathologist must review the pathologic material first. A couple of treatments. Chemotherapy can cause some side effects such as hair loss, mouth sores, loss of appetite, nausea or vomiting, diarrhea or constipation, increased chance of infections, easy bleeding or bruising, and fatigue. Radiation therapy. Common side effects are sunburn, like skin problems, hair loss in the area where the radiation enters the body, fatigue, nausea or vomiting, loss of appetite, weight loss, increased chance of infections, easy bruising and bleeding, feeling weak or short of breath. Surgery can cause possible complications during or soon after, depending on the extent of the surgery and a person's health beforehand, such as excessive bleeding, wound infections, and pneumonia. And this is continued. And chemotherapy, those side effects depend on the type and dose of drugs given. They also depend on the length of time they are taken. They are usually short-term and go away after treatment is finished. Radiation therapy, most of the side effects go away after treatment is finished, but some can last a long time or may be permanent. Surgery, those complications usually go away after surgery and recovery time. And those are just some quick pictures of what some of it looks like. Reducing your risk. There is no way to prevent lung cancer, but you can reduce your risk by doing a couple of things, such as not smoking or to quit smoking, avoid secondhand smoke, testing your home for radon, avoiding carcinogens at work, having a good diet, and exercising. Some factors can be avoided while others cannot. Smoking can be avoided, but inheriting genes cannot. And these are all my references.